everything that I put in that guide, everything I talk about on this show, it's framed for midlife women. And it had left a lot of people wondering where the men fit in. Because men are not immune, right? Of the 7 million US adults living with clinical Alzheimer's, over 2 million are men, a third of all patients. So let's talk about how Alzheimer's actually shows up in men. Because this is where I think a lot of families get blindsided. Well, hi there, Amy here. Thank you so much for joining me today, and welcome back to another episode of Happy and Healthy with Amy. So earlier this week, I had a really interesting email exchange with a friend and colleague of mine, Gotham. So he's a financial advisor, and I had shared my first steps guide with him for some feedback. This is the free guide that I wrote for the daughters whose mom was just diagnosed with Alzheimer's. And after noting how helpful he thought the guide was, his next question was, is this applicable to everyone or just women and their mothers? And I paused because, yes, it does apply to men and fathers, but his question made me realize something. Everything that I put in that guide, everything I talk about on this show, it's framed for midlife women. The biology, the risks, the menopause connection, right? And while that framing is right for my primary audience, it had left Gotham and probably a lot of other people wondering where the men fit in. And since June is Alzheimer's and Brain Awareness Month, I thought, how about an episode about this, comparing and contrasting men and women? And lo and behold, I found a study that just came out last month, so May of 2026, from UC San Diego that looked specifically at how dementia risk factors affect men and women. And it turns out there are some key differences. And what the research suggests you can actually do about it for both men and women might surprise you. So while this show is still for women in midlife, if there's a man in your life, a father, a husband, a brother, an uncle, a cousin, a partner, right? This episode is for him too. And if you're a man listening right now, welcome. I hope you find this helpful. And as always, this is education, not medical advice. So for personal health decisions, please work with a qualified healthcare provider. All right, let's get into it. To start, let me just make sure we're all on the same page. Okay, when I say Alzheimer's, I'm referring to the late onset form of Alzheimer's disease. This is the most common form of dementia, and it's a progressive brain disease that affects memory, thinking, judgment, language, behavior, and eventually the ability to carry out everyday tasks. And it's caused by changes in the brain that begin years, okay, we're talking 10 to 20 years before any symptoms appear. So there are two proteins, amyloid and tau, that build up in ways that damage and eventually destroy the brain cells called neurons. But because the brain is remarkably adaptive and resilient, it can compensate for that damage for a long time until it can't, and then symptoms appear. Okay, this is referred to as clinical Alzheimer's. In other words, by the time someone is forgetting names, getting lost in familiar places, or struggling with tasks that they've done hundreds of times, the disease has likely been underway for decades. Okay, that's why one of my mantras is early is everything, because Alzheimer's isn't a disease of old age. It's a disease of midlife where symptoms appear much later. Okay, so when I say the most common form of dementia, here are some numbers you probably already know, but it's helpful context for this discussion. Okay, as of 2026, according to the Alzheimer's Association, over 7.2 million US adults are living with clinical Alzheimer's. This is known as prevalence, okay, the number of new and existing cases. And of these 7.2 million, 2 out of 3 are women. And the explanation we were given for a long time for this ratio was simply because women live longer. But if you look at the incidence rates, okay, this is the rate of new cases being diagnosed. Women are diagnosed at higher rates at almost every age. So longevity can't be the only reason. Okay, so what else does that work? Well, again, there was actually a study published just last month that helps to answer this question. It's titled Sex Differences in Modifiable Risk Factors of Dementia and Their Associations with Cognition. These are not catchy book titles, right? But they're very descriptive. So the study is from UC San Diego, again published in May 2026. And they pulled data from something called the Health and Retirement Study. This is a nationally representative data set of US adults in mid to late life. Okay, we're talking 17,182 participants aged 40 and older. 59% were women, 41% were men. So enough of both groups to actually do a real comparison, right? And I want to use this study as a teaching moment for critical thinking. The same way we use the Cochrane Review on anti-amyloid drugs, right, that episode, to zoom out on the hierarchy of evidence. So we're going to talk about something that's the foundation of all legitimate scientific research. So at the beginning of any study, scientists have to state what they expect to find. They have to go on record with their prediction. And then the data either confirms it or it doesn't, right? That prediction is called the hypothesis. Then they design an experiment to test the hypothesis. And what happens when the data surprises you? When it overturns what you expected? That's not failure. Okay, that's science working exactly the way it's supposed to. And in this UC San Diego study, that's exactly what happened. So the researchers, Dr. Megan Fitzhugh and Dr. Judy Pa at the UC San Diego School of Medicine, went into this study with 2 hypotheses. Number 1, men would have a higher prevalence of more risk factors than women. And number 2, the presence of a given risk factor would have a greater effect on cognitive performance on women compared to men. Meaning, whatever risk factors women do have, they'd hit harder. So 2 predictions, one about who has more risk factors and one about whose brain pays a bigger price when they have them. And they looked at 13 modifiable dementia risk factors: education level, hearing loss, cholesterol, depression, physical inactivity, diabetes, smoking, hypertension, obesity, excessive alcohol use, social isolation, poor vision, and poor sleep. And after analyzing the data, they found out they were wrong. With hypothesis number 1, they were wrong. Women actually had a higher prevalence in 7 of the 13 risk factors. men had higher prevalence in only 3. So women were more likely to have elevated cholesterol, depression, physical inactivity, smoking, poor vision, and poor sleep, and fewer years of education. So men had higher rates of hearing loss, diabetes, and excessive alcohol use. And then high blood pressure, obesity, and social isolation were similar across both groups. Now, hypothesis number 2, right, the one where they predicted risk factors would hit women's cognition harder, that one held up. So even though hearing loss and diabetes were more common in men and high blood pressure was about the same, all 3 were associated with greater negative effects on cognitive performance in women than in men. Also, having a higher body mass index, or BMI, was associated with lower cognitive scores in women at ages 55 and 65. And to give you a sense of the range we're talking about, the average BMI in this study was 29.3. So that's at the upper end of overweight, right? Just below the obese threshold. So this isn't about extreme cases. This is the weight range that describes a lot of midlife adults here in the US, right? And here's a finding that I think will surprise you. I know it surprised me. In men at those same ages, 55 and 65, higher BMI was actually associated with better cognitive scores. So same BMI range, opposite direction. Not fair, right? Well, if it's any consolation, by age 75, that difference was gone. And like you're probably thinking right now, the researchers flagged this as needing more investigation and suggested the higher rate for women may be connected to the metabolic and hormonal changes that happen during the menopause transition. So the biology is still being worked out, but the pattern in the data is pretty clear. Okay, and then one more finding worth noting, and this one is a positive one. More education and cholesterol management had stronger positive associations with cognitive performance in women than in men. So this suggests those protective factors may matter even more for women than men, as in more upside when you address them. Now, a few caveats about what this study can and can't tell us. Okay, first, this is an observational study, not a randomized controlled trial. Right? It used a large existing data set that relied on self-reported information. So people were asked about their physical activity, their sleep, their alcohol use, right? And self-reporting has limits. People underestimate, they minimize, or they exaggerate, or they simply forget. Second, observational studies identify associations, but they can't prove causation. Okay, we can say hypertension is more strongly associated with cognitive decline in women, but we can't say it causes more cognitive decline in women from this study alone. Okay, and then third, the study identifies the pattern, but not the mechanism. Right? So we don't know why these risk factors show stronger associations with cognitive performance in women than in men. And the researchers themselves call for more work, specifically sex-stratified clinical trials and risk assessment tools that apply different weights based on sex. So here's what I want you to take away from this. Every study you read, every headline, every new research shows, there were researchers behind it who went on record with a prediction, with a hypothesis, before they looked at the data. And then the data either confirmed it or didn't. And when it didn't, again, that's not failure. Often that's where the real learning happens. So, remember that number from the top of the episode? 2 out of every 3 people with Alzheimer's are women. I think this study makes a pretty compelling case for why it's not just about living longer, right? Women aren't just carrying fewer risk factors and responding to them more strongly. Women are carrying more risk factors and responding to them more strongly. Both. That's what the data shows. Okay, now let's talk about the men. Because men are not immune, right? Of the 7 million U.S. adults living with clinical Alzheimer's, over 2 million are men, a third of all patients. So there was another study from the University of South Carolina in 2025 that looked at over 6,000 patients diagnosed with Alzheimer's. And then researchers compared the risk factor profiles between men and women. And here's what they found. Men diagnosed with Alzheimer's were significantly more likely to also have dyslipidemia, okay, that's abnormal cholesterol, which includes elevated LDL or bad cholesterol, high triglycerides, or low levels of HDL or good cholesterol, as well as peripheral vascular disease and obstructive sleep apnea compared to women with the same diagnosis. So that finding is consistent with what other research suggests about the heart-brain connection, that vascular health and brain health are closely linked. Which makes sense, right? The brain is the most vascular organ in the body. I'm talking about your blood vessels. And then sleep apnea, which is much more common in men, has been associated with the disruption of deep sleep, which is when the brain's overnight cleanup process that includes the removal of amyloid and tau occurs. So these are risk factors most men never think of in the context of brain health. Now, this 2025 study looked at people who were already diagnosed. Okay, but these same factors show up consistently in prevention research too. So if there's a man in your life, a father, a husband, a brother, an uncle, a cousin, or your partner, right? A conversation about better brain health might focus on blood pressure, cholesterol, and whether he's been assessed for sleep apnea. Okay? Now, let's talk about how Alzheimer's actually shows up in men. Because this is where I think a lot of families get blindsided. So the public image of Alzheimer's is memory loss, right? Someone who forgets names, forgets appointments, can't find their keys, asks the same questions over and over again. And yes, that happens in men. But a large study using the National Alzheimer's Coordinating Center database, this is over 11,000 patients, found that men with Alzheimer's show significantly more severe irritability, apathy, disinhibition, agitation, and nighttime behavioral disturbances than women with the same diagnosis. So women in this study showed more severe depression and problems with executive function like judgment and problem solving. Okay, so what does that look like in a person you love? Well, it might look like your dad becoming uncharacteristically irritable with people he's always been patient with, or your husband losing interest in the things he used to care about deeply, right? His hobbies, his friendships, the news, okay? Or it could look like social withdrawal that gets attributed to aging or grumpiness or just being that way. And unfortunately, these behavioral symptoms in men are frequently misattributed to stress, to depression, to personality. And because men are less likely to report cognitive symptoms themselves, shocking, right? It means medication that could help with symptom management doesn't get prescribed. And here's where I want to come back to Gotham's question. Does what's in the First Steps Guide apply to men? Yes. And in section 4, More Than Memory Loss, it lists what to watch for beyond memory, like taking medications correctly, managing money, cooking and driving safely, navigating familiar places, and then changes in mood. So anxiousness, irritability, withdrawal, okay? So that list was written with a mother in mind. But for a father or a husband, those mood and behavioral changes, the irritability, the withdrawal, the apathy, those are exactly what the research shows tends to dominate in men with Alzheimer's. And then the other sections in the guide, like making sense of the diagnosis, the conversations to start now, and building a care team, all of that applies regardless of whether it's a mom or dad. And then section 7, you have agency, right? That one is for anyone in this audience who is quietly asking, am I next? So it's not just daughters, right? Sons ask that question too. And by the way, Gotham is going to be a guest on this show and share what kinds of things he, as a financial advisor, is trained to look for and some of the real challenges he's seen with his clients. So you're going to want to stay tuned for that. Okay, make sure you hit that subscribe button. So just like the book Men Are From Mars, Women Are From Venus, when it comes to Alzheimer's, there are some distinct differences. But, and this is an important but, everything that addresses the modifiable risk factors for dementia that we've been talking about today works for both men and women. And the restored protocol I use addresses almost all of them. Okay, so we're talking about 8 essential evidence-based lifestyle factors to build an Alzheimer's resistant brain so you can stay sharp for life. And if you're a man listening to this, or if you're sharing this with a man you love, I want to say this directly. Your risk is definitely lower, but you are not immune, right? 1/3 of Alzheimer's patients are men. But the fact that you're in this conversation at all, paying attention, asking questions, thinking about prevention, that already puts you ahead of where most men are. So kudos to you, and thank you for listening, especially if you've made it this far into the episode. Right? And of course, the real power of prevention is in the implementation of the restored protocol, right? Knowing what to do is not enough. So if you would like some help in tailoring your implementation plan, like identifying which risk factors to pay attention to, or which lifestyle interventions to prioritize, or which ones you can combine with the miracles of modern medicine, like statins, right? Feel free to book a discovery call with me to see if one-on-one coaching is right for you. So I've included a link in the show notes for that. And if you'd like a copy of the Restored Protocol Guide, just go to amylinecoaching.com or use the QR code on the screen if you're watching on YouTube. Again, this is the 8 essential evidence-based lifestyle factors to protect your brain. It's free and it's just an email away. Okay? And if you have a parent who was recently diagnosed with Alzheimer's, my First Steps Guide, the 8 things you need to know, was created exactly for this moment. So 8 things you need to know so you can support them with more clarity, calm, and confidence. So the link is also in the show notes, or you can use this QR code here. Okay? And finally, given this month is Alzheimer's and Brain Awareness Month, please help me spread the word that prevention is possible, that lifestyle matters more than genetics, that midlife is a critical window for prevention, that making healthy habits stick can be easy. And together, let's rewrite the future of Alzheimer's. All right, so I want to wrap things up today with a quote from Henry David Thoreau. It's not what you look at that matters. It's what you see